Hi everyone. My name's Matt. I'm a clinical massage therapist. So what does that mean? Clinical massage therapy means that probably anatomically speaking, we're on a level with physios and osteos. However, we cannot diagnose. But that doesn't mean to say that we have a pretty good idea of what's happening with people's bodies, and we will refer, and osteos and physios will refer to us due to our level of anatomy and physiology. So part of that is sports massage. So I would say I'm a clinical and sports massage therapist, but putting that aside, obviously sports could be for injury, it can be for rehab, it can be for maintenance. So we'll put that aside for the moment and discuss what clinical massage actually is. For me, clinical massage is a fusion of East and West. Eric did a talk last week on Tibetan medicine and talking a lot about how one treats the whole body. So not just the pathology, not just the pain, not just what's going on. So clinical massage really is, as in the description, a multimodal approach to working with pain. That could be acute pain or chronic pain. So chronic pain is normally described as something that's lasting maybe 6 months, something that hasn't cleared up for whatever reason, which we'll go into a little bit later. So I would say clinical massage will borrow heavily from Eastern and Western, like a fusion. So as in the Western massages we know, like Swedish deep tissue, sports massage, but also some of the Eastern influences such as Thai massage, such as fusion from Japanese, which is a compression massage, acupressure points and that kind of stuff. So it's a fusion, but a very considered fusion, if you like. So that would be how I would start to describe clinical massage. One of the main things with clinical massage is about the Therapeutic Alliance. So that is something that, as TruthPie will know, I'm very, very keen on the initial meeting with people, because the Therapeutic Alliance is really important in helping that person on their journey through their pain. So a Therapeutic Alliance means that the person that comes to see us will trust us and trust us to be looking out for them, working on them, giving them plans, giving them exercises and working through. One second. And working through their pain. So the Hippocratic Oath means that as a therapist, we would only work within our remit. So that would mean, for instance, I wouldn't give nutrition advice, or if I could see somebody clearly needs to be going to A&E because they've got pain going down both sides of their body, then I would take them, hi Zoltan, then I would take them to, then I would ask them to go to A&E, for instance. So that's the Hippocratic Oath. But the original interaction with a therapist is really strongly connected to how well that person will heal and how their pain will heal. So that's why for me, a consultation at the beginning of any therapy is really important. Secondly, it's about informed touch. So sometimes I would say that I don't really know how I'm going to work with a person. Of course I do, but until the person is in there with me in the room and lying down, then we'll do a lot of palpation to see what's going on with the body, for instance. And I'll go into that a little bit more. So myself personally, I'll probably put my hands in the last couple of years on maybe 3,000 bodies. So that's quite a lot. So you kind of get to see how, what's happening with people's bodies and how you're going to work with them. So that's called an informed touch. And we often in the consultation use a lot of stuff from person-centered counseling to see what's going on, not just with the physical body, but what's going on with emotional pain as well. So as you know, massage obviously is a touch therapy. I often don't know how I'm going to work, but that will just depend on the person. It will depend on the treatment outcome. So clinical massage, just to sum up, there is a fusion of East and West. Now, there's a mnemonic that we use at the place that I trained at, which is called Jing in Brighton. I trained there for 3 years, so I have a degree specialism in sports and clinical massage. So their mnemonic is HF MAST. So HFMAST. So that would mean that the therapist will consider a few things, such as whether they're going to use heat or cold. More about that later. The fascia, which is the connective tissue, what's happening with that, and I'll go into that a little bit more. The muscles and knots, or as we call them, trigger points. Whether you're going to use acupressure, the type of stretching that you're going to use, and the T in HF MAST is teaching. So how we teach our clients to learn more about their bodies and how they can help themselves, and really have a regime of self-care. So that's very important, the T, and that's exactly what I'm doing right now. So as I said, with the consultation, we take a full history. I'd call it a clinical assessment, really, a full history of the person. So often when you speak to people, they might forget that they fell out of a window when they were 6. And as we go to talk about fascia, we might know that actually some trauma is accumulating in the body from that time, which the person has either put back into their subconscious. Or it may be they've been in a car accident and they have whiplash. It could be emotional trauma, something that's happened, a big life event that's happened. It could be people over, especially women over 50, who maybe when their children leave home and there's a big kind of, there's a big emotional change for people. So different parts of society may have different things going on. And the next thing I want to talk about is in a clinical assessment, we do an orthopedic assessment. So we'll take the person through a range of movements, and that's really to see if maybe it isn't the muscle that's causing the pain. It might be a ligament, or it might be a tendon, and there's some certain tests that we can do, which a physio would do generally, and they would be active, which means that the client will move. It will be passive, which means we lift them up and we move them. So a particular muscle, like a shoulder muscle, we would do it. And the other one would be where it will be a counterbalance. So the therapist will push against the particular muscles, and then the client will move. So that's 3 types of tests that we would do for orthopedic assessment to find out where the pain's coming from. And that means that we can get to the pain directly. We don't have to work on something that doesn't need to be worked on. And then we'll look at what's going on in the emotional body. So what's the level of stress? Obviously, lots of stress at the moment, which is likely to continue. What are the sleep patterns like? What else is going on with friends, family, partners, that kind of stuff, which all has an effect on the body. And in this consultation, we'll do some SMART targets, so some specific, measurable, achievable targets to help manage the person out of pain. So HF MAST again, HFMAST. I'm going to leave the H, which stands for heat. Now, heat, sometimes we use hot, sometimes we'll use cold. It's very rare that we'll use cold these days. Maybe in some acute things, something's just happened and there's some inflammation for a while, but pretty much nearly all the research now says that in terms of the body repairing, it's heat that is very important. Quite often things that aren't directly onto the body, but a heat pack, it just makes the whole body feel, the brain, the parasympathetic nervous system, the calming vibes that you get, is much more important. So pretty much heat therapy is much more important these days. So that's all I'm going to say about that, because when I do another session, we can go more into detail. But I want to talk about probably the benchmark. And the very important thing with clinical massage therapists is talking about the fascia, the connective tissue. So when we learn about muscles, we kind of think that we're a robot, that all the muscles are completely separate, that my triceps or my biceps are completely separate to my calves. which is possible. So that's how we learn that everything's really, really compartmentalized. And really, we're more like a network of spider men or spider women or spider people. So the fascia is all over the body, the connective tissue, even blood is fascia. So with fascia can store emotional trauma, as I mentioned, it can store physical trauma. And we have a 3D matrix of structural support. So it's a gigantic spider's web. And with that, we do two types of fascial work, which can be direct fascial work, which is often for kind of structural integration to balance the body, where there are some imbalances. So if you were to lie down and one leg was a little bit longer than the other, it probably generally doesn't mean that one leg is longer than the other. It means all the fascial restrictions or the connective tissue have sucked up maybe one leg up into the hips. So with that, we will do some direct fascial work to release that, some myofascial work. There's also some indirect fascial work, which is normally deals with people who are experience a lot of emotional pain, and it's a lot more gentle, where we'll do things like something called transverse fascial planes, which is really just kind of holding and waiting for the tissue to move. So we never force anything, we just wait for the connective tissue to move, and then to stop the adhesions and to start making the fascia more healthy and more flexible. Next, I want to talk about the fascia will then hold trigger points, which I'll go into at the moment. So trigger points, as we normally see them as knots. So a trigger point really is a band of muscle that's got stuck. And that obviously will cause pain, along with the fascial pain. The brain is really connected with pain and fascia. So there's a direct link between the fascia and the brain. So the nociceptors in the brain, it's a bit like if I put my hand on something hot and I pull my hand away because the brain has told me that's really painful and I shouldn't do it again. But what happens is the brain can actually choose which of those stimuli it decides on, whether that's going to be a danger to the body. So pretty much with fascial work or clinical massage, if the person really feels they're going to get better, if they've had a good experience, it's quite likely, and they don't catastrophize and think things aren't going to get better, it's quite likely, due to the thoughts of the brain and how the fascia responds in the connective tissue, they're much more likely to get better sooner. So it's a quite a massive subject, but just to know that, you know, the brain does quite a lot in hindering the body to repair, but can also do quite a lot to help as well. So all of this is part of something called the Biopsychosocial Model, which just means your environment, your psychology, your biology, all those things are linked. It's not just a case of you come for a massage, you lie down, you get treated, you go away, or you feel better, and you go away, you feel better, and that's great, and then you book your next appointment whenever that might be. So there's a lot going on, all intertwining, and that's kind of the underpins clinical massage, I would say. So it's nice to know that we're not robots, we're kind of really being held up by all these interconnected 3D tissues. So we're like a jelly-like substance moving around, swimming around, and the erector spinae, the muscles holding us up, the back muscles, obviously they're keeping us upright, but the rest of it is pretty much, you know, kind of jelly-like and movable. As it's an interconnected system, as I said, it's possible that a strain in one part of the body will cause pain, but it also might cause a lack of mobility and pain in another part of the body. So it might mean if you have neck pain, the therapist may be working on your calves, because the body has a fascial line. So it goes right from the metatarsal, so right between the feet, up below the feet, up down the muscles at the side, of the leg, up through the TFL and the IT band on the side there. Then it will go into your hip flexors, and then it will go up into your lats here, and then it will go under and then up into the scalenes, the muscles here, the neck muscles, and right up into the back of the neck, so the occiput here. So all that is one fascial train. So we may be working on a completely different part of the body to the one that feels pain, because, as I say, they're all interconnected. We have superficial fascia, so just below the surface of the skin. Then we have deep fascia, and when we do the deep fascial work, that means that we one second. When we do the deep fascial work, that's where we will start using sometimes elbows and sometimes knuckles to get into the deeper compartments of the fascia. However, generally I don't use elbows because elbows don't really feel anything. So one second. So elbows don't really feel anything. Next, I want to talk about the muscles are not a separate part of the body. The muscles are a separate unit. So like I said, the biceps, the traps, they're not all separate. They're all part of a large fascial network, which has their own individual motor units. They're not separate muscles. So holistic, whole, which is the point of the talk today. Holistic is maybe a word that's been hijacked, or it's changed its semantic meanings over time, but holistic used to have a W, so it was holistic. So we're looking again at the whole body, and going back to those ideas of treating the person, not the pathology. As I mentioned, the fascial train, there's one that goes up the side of the body. There are fascial trains at the front of the body, at the back of the body, the side of the body. So without going into too much detail, I think you get the idea of fascia, connective tissue, how all of them are linked. So fascia may be an important part in the source of pain. So if there's micro-tearing, if there's inflammation, the fascia can be a source of pain, such as things like tennis elbow, where you get pain in the epicondyles and the connective tissue of the forearm flexors and extensors here. Plantar fascia, where runners who get pain on the surface of the foot that goes back into the heel. So then you're looking at the fascia on the base of the foot. Fibromyalgia, which is an unspecified pain that happens all over the body. A diagnosis would be that there are maybe 6 or 7 pain patterns over the body, and that may not be the trigger point. So when we're dealing with fibromyalgia, we have to deal with the fact that there may not be trigger points. They might actually be pain patterns, and that might you have to work with the client tolerance there, because there might be some pain and discomfort. So any stuck fascia can lead to pain. So whichever part of that body that might be. There's a big fascial train, if I stand up, that just goes around the hips as well. So often if you're feeling lower back pain, there's a great big band of fascia that goes around the middle of the body as well. So that's fascia. We move on to muscles, which is the M. So we've dealt with H, which is heat or cold. We've dealt with F, which is the fascia, connective tissue. Now we're dealing with M, which is the muscles. Muscles have trigger points. So you may come to us and say you have knots. You can feel knots, that it's really tight. They are what we call trigger points. They can give referred pain patterns. So again, the body is telling you wherever you feel the pain, it may not be coming from that point. So this is one of my Bibles here, which is Finando in Fernando. It's called the Trigger Point Therapy for Myofascial Pain. So if you look here, there's lots of pages. So this is called the SCM. So this is the big neck muscle. So if you pull the muscle here, as if you were picking up a puppy or a kitten. So this is the muscle here. So this is called the SCM. And as you can see, there are trigger points here. Those red dots are the trigger points. And what will happen is those muscles will cause or can cause headaches. So this is depending on which muscle in the neck. This will cause a kind of question mark headache. So all those red dots are where, if the sternocleidomastoid, the SCM, the big neck muscle there, if there are trigger points, that's a big cause of migraines and tension headaches. So that's just one quick example. I think I have another one here as well, which we'll go into later. Everybody is feeling quite stressed at the moment, I would say. I was doing a palpation, which is touching my pectorals before, and seeing I have loads of trigger points there, probably because I'm probably stressed along with other people. So they are the trigger points there in the, I hope you can see that, in the pectoral muscles. And those trigger points will cause pain in the deltoid, so the top of the arm, the whole of the pec minor, the small pectoral muscle just here, but also that can run all the way down to your wrist, so that can send pain right down the arm and into the wrist. So sometimes people think that they have like a carpal tunnel syndrome or wrist pain, but it could actually be coming from here. So fascia and trigger points are a steady marriage. They both love each other or work with each other. So what we do generally with a trigger point, and you can do it yourself here, is if you place your hand here upon your pec muscles and you palpate it, you may find you have a taut band of muscle. And when you find that, and it will feel perhaps a little bit painful, you can just, what we do is we press that for between 8 and 12 seconds, not pressing too hard so it actually hurts and it's really painful. And in a treatment, we maybe do that 3 times. So we hold it for about 8 to 12 seconds, and you should start, and it may feel a little bit tender, but you should start feeling it release. So obviously when I do some videos for some self-help, we'll spend some time doing this. I'm just giving an overview at the moment, but you can do that. You can also use your palm, the flat surface of your palm, because remember, this pain can go all the way down the arm into the deltoids, the muscle at the top of the arm here. So you can go right here and self-massage. Of course, everyone will be different, and everybody will hold tensions in different parts of the body. So we'll practice that much more in the webinar. So, I want to talk a little bit again about acupressure points. Again, I'll go more into this when we do the webinar again. So obviously the acupressure points link to kind of Chinese medicine, the meridians of the body. There's a high correlation with acupressure points and trigger points. Now, although they were evolving at completely different times in completely different parts of the world, obviously from Chinese medicine, maybe 3,000 years ago, there were all the practitioners saying, "Oh no, there's no link," but pretty much there's probably a 95% correlation between them. And we'll do more with that in another webinar. The S in HF MAST is stretching or mobilization. So if somebody comes with a pathology, maybe like a frozen shoulder, where they can't move the shoulder, it's got very, very stuck. So we need to work on the fascia there, but also we need to mobilize. So mobilizing stretching. So depending on what the pathology is, will depend on the type of stretching that we do. There's some active stretching, there's some passive stretching. So active stretching is where you assist the therapist in stretching. Passive stretching is where we will stretch you. There's different forms of stretching depending on what you might need. So some people would need also strengthening, and that's another thing with clinical massage, is that stretching and strengthening shouldn't be seen as polar opposites. They're actually part of the same thing. So we will look and see what will be appropriate. So the T is for teaching, which is what I'm doing now. So self-care is really important. Exercises that you can do at home. It's really important for the Therapeutic Alliance for working with your therapist. Sharing knowledge is amazing. Why perhaps we are working on one part of the body where the pain is felt elsewhere. Clients often feedback to me to say, oh, he kind of explained what he was doing and why he was doing it. And while I like to keep that to a minimum, it's really important to, I don't want to shroud this kind of work in mystery. I want to share the knowledge and to educate people, because that's good. That can only be a good thing. So you do educate your clients, and also it allows you to get feedback from them, so they get more in tune to their body. They see what's going on, and they can help you. And obviously that very much helps the treatment. So I am Active Release Therapies on TruthPie. The reason why I'm Active Release Therapies is partly because of the acronym, which is ART, art, because I see clinical massage as an art, because when you start working on a body you don't know. Somebody called Godin and Hagi in 2010 said, art is a personal act of courage, something one human does that creates change in another. And that's always kind of stayed with me. So Active Release Therapies, ART, art. And I do see it as an art. I do see when I'm massaging people and I'm around the table, doing my Thai massage, doing my stretching, I really do see it as a kind of dance, as a piece of art. So one last thing before I go. Considerations, I think, for a bespoke session. Like I say, it depends on what people come with. So I will choose, am I going to do a Swedish? Is it indicated or contraindicated? So what is the clinical reasoning for that treatment? So is Swedish massage appropriate? Is a deep tissue massage appropriate? What kind of fascial release will I do? Do I want to get the person into the parasympathetic nervous system? Do I want to calm the body down? Do I want to change the structure of the body? Do I want to balance things out? Is it safe to get up onto the couch and do some compression, do some fusion or some Thai type massage, depending again on the pathology? So if I use my body weight on somebody, is that going to be too much for their condition? As I mentioned before, trigger points. Are they trigger points, or are they pain sites, as in something like fibromyalgia or autoimmune issues? So that's the other thing. Clinical massage, which perhaps I should have said before, is it's not just musculoskeletal. It can also be for systemic things like multiple sclerosis and stuff like that, HIV. And the appropriate, as I said before, the appropriate stretching and strengthening, because some things will be indicated, other things will be contraindicated. How long can the person stay on their front or back? A work with client tolerance. What do they need to make them feel comfortable? And finally, self-care, which I will go into more detail when I do the next webinar. So in the coming weeks, I will be doing some group sessions on self-care, and definitely I will be doing some self-care on neck and shoulder pain. Also on kind of asthma and lung capacity and kind of stress. Also, I'm going to be doing one on wrist and forearm pain. And I will be doing one on migraines as well, so people who suffer migraines. So if you know anyone who suffers from any of those conditions, has any of those conditions, then get them in touch with us. For now, I would say it's really good to listen to your parasympathetic nervous system. So there are lots of therapists with TruthPie, or with a wonderful range of disciplines. So whether you're working on, with body psychology, whether you're working with meditation, whether you're doing fitness, whether you're doing kind of Tai Chi or yoga, all those kind of things. So the other thing is I would spend some time just lying down in a comfortable position and just palpating your body, just taking time to palpating your body and seeing, well, what can I find? Where are there kind of tender spots? Where are there sore spots? Where do I feel stiff? So a lot of the self-regulation, a lot of the meditation some of them will ask you to really tune into your body. So that's what I would say for before we go gung-ho into any kind of help, is just spend some time with yourself and listening to your body. So that's what I would say. So I hope that's been useful, and if you have any questions, you can ask me questions via TruthPie through our Facebook page. I am on Instagram at Active Release Therapies, so feel free to send me questions there. I hope it's been of use, and thanks very much.